Medical science has made rapid changes over the last century. As technology has evolved, our ability to understand and treat illnesses and ailments has improved at astonishing rates. But that is just medical science. The healthcare systems across the world don't necessarily improve at the same rates. In fact, healthcare systems across the world differ greatly. Let's look at some examples of how different countries handle healthcare. Luxembourg is not only a wealthy and beautiful country with natural sceneries, it also has what is said to be the world's best healthcare system. Their public health fund is made up of 5.4% of each citizen's gross income. This fund enables the country to provide its citizens with free, high-quality healthcare. Luxembourg also has the lowest mortality rate among the EU member countries. Singapore has a hybrid healthcare system, sharing medical costs between patients and the state. A number of plans are in place to ensure all citizens can afford healthcare without relying heavily on the government. These plans are dependent on a variety of indicators such as salary, income, and health status. Less money spent by the state on patients enables hospitals to be renovated and more doctors and nurses to be recruited. As a result, Singapore has a very high average life expectancy at about 83.1 years, as well as low rates of infant mortality at just 2 per 1,000 births. Being one of the world's wealthiest countries in the world helps when it comes to providing an efficient healthcare system. With more money to spend on equipment, research, and medical staff, citizens of Switzerland receive healthcare that is up-to-date and efficient. Its healthcare service is universal and is based upon the mandatory holding of health insurance by all citizens. Japan's public-private hybrid healthcare system saves the government a lot of money and enables the country to provide a high-quality service. In fact, it is one of the cheapest healthcare systems in the world. Austria has a healthcare system based on mandatory health insurance. Austrians pay a premium of around 25 euros per month for their health services. Sweden is characterized by high standards of quality care and above-average healthcare spending. The country has a high proportion of doctors and well-connected network consisting of public hospitals and private clinics. Even though upfront payments are the norm, the fees are reasonable and prescriptions are subsidized. Health insurance is compulsory for all citizens in the Netherlands, and for those who cannot afford insurance, the Dutch government provides financial support. Over 4,000 euros per citizen and more than 10% of the GDP is spent by the government on healthcare. This is among the highest amount within the entire European Union. Spain offers free, universal healthcare to anyone who is a resident legally or illegally in the country, as well as to tourists and other visitors. Some 90% of Spaniards use the system, with about 18% signing up to private healthcare schemes, including many public sector workers who are given the option of free private care. The Danish have a universal healthcare system that provides them with mostly free medical care. All permanent residents are entitled to a national healthcare insurance card, and most examinations and treatments are free of charge. Canada has a universal, publicly funded healthcare system that consists of a group of socialized health insurance plans providing coverage to all Canadian citizens and permanent residents. Every citizen is provided with preventative care, medical treatment, access to hospitals, and dental surgery. Canada holds a remarkably high life expectancy rate, which many attribute to the efficiency of its healthcare system. Of course, these are just a few of the many systems across the world. Medical science is moving forward at incredible speeds, making treatments more easily performed and even granting the possibility of treatment to patients who previously thought there was no hope. But the accessibility of these newly possible treatments can be bottlenecked by inefficient systems.